Hello and welcome to Elets eHealth Innovation Talk, a series where we speak to industry players and thought leaders about the revolutionary business ideas and innovations that are transforming the healthcare sector. Elets eHealth has been actively engaging with industry leaders, policymakers, and voices that make a difference to highlight technology innovations in healthcare since 2005. Joining us today, we have Mr. Shailesh Singla, Country Head and Senior Director, HCM Cloud Oracle India, who will be sharing his thoughts around how cloud and other technologies are transforming the healthcare sector in the country. Welcome, Mr. Singla. Thank you so much for joining us today.
Thanks, Garima. Thanks for having me here.
So, sir, we'll dive straight ahead into the discussion. As we all are aware that, digital transformations have been, transforming the healthcare sector in the country. So I wanted to begin the interview by asking, how is it the digital transformations in the healthcare sector are going around? And, how is the role of cloud and artificial intelligence in transforming the healthcare and pharma providers?
So Garima, basically healthcare industry vertical is a very big vertical. And if we go down, like it's further bifurcated into many industry verticals, right? Like one is hospital chains. So second is like diagnostic centers. Okay, third is pharmaceutical space. And then there's a healthcare insurance arm, then medical devices and pharmacy. So AI is playing a very, very important role in every vertical of it. Okay, I'll just give one example. Okay, so in terms of like, if you look at the hospital chain, okay, it's not only the diagnosis and prognosis of diseases which is there. It's also helping in doing some of the most complicated procedures. Okay, in today's time. And second, like if we look at the diagnostic space, okay, I'll tell you like the way the chest X-rays are done. So the AI is able to do the analysis of those X-rays in a much better way than the radiologist can do it right now. Okay, in terms of like cancer treatment as well, there is so much of research and so much of development has happened through AI that we are able to guide them in a much more proper way than even a doctor. Okay, in the pharmaceutical space, okay, earlier the vaccination development used to take 10 to 15 years. Okay, now this has expedited with AI. Okay, this is expedited and now it's taking much lesser time than what it used to take. Now we would have seen it in case of COVID as well. The vaccination was turned out much faster, and it's one of the outcomes of AI. Okay, next is like on a healthcare insurance side, like the AI is helping humongously in terms of detecting the frauds which are happening, in terms of like faster claim settlements and all those things. In medical devices, so many smart devices are being, they're using AI, which is helping to track the patient and the health of the patient in a much better way to give a much better experience to the patients. So lastly, like in a pharmacy space as well. Okay, so in terms of like, in the hospitals, like pharmacies are able to track their what should the ideal stock, what is the composition that will come at that particular portion of time. So all this is driven by AI in terms of predicting the right volumes, or the medication, which medicine, what time, and then placing in orders to different suppliers. Okay, so that's where it is broadly like AI is playing a very important role in terms of providing us with the predictive intelligence. And on the other side, the part of the cloud is like, making this information worldwide available to everyone. Okay, so like if a person, I would say, is traveling to any part of the globe, so he's carrying all his data points in terms of his doctor's recommendations, consultation, his tests being done, his medicines he's taking. So he has the entire record. On the other side, when doctor is there, so doctor has the entire history of the patient. Okay, so this is how, I'll say like the AI and cloud is making a big difference.
Right. So there's accessibility that has actually been, provided by these new technologies. Now, in terms of, so you've mentioned the technologies that we are witnessing, but apart from that, do you see any other technology trend in the healthcare sector and probably the future prospects, according to you, that are lying ahead for the healthcare sector?
So Garima, actually, so much is happening in this space and so much innovation is happening. Okay, I already covered up on the AI side. So other things which we see, like as Oracle, like when we look at the prospects and the customers which are coming to us, we see a lot of momentum around IoT. Okay, the smart devices. Okay, so the healthcare institutions are looking at deploying some smart devices to the patients to track their vitals. Okay, in terms of like these vitals, tracking these vitals helps to trigger the alarms to the nurses and the doctors. At the same time, some smart devices being deployed on the bed to track, how the sleep of the patient has been. Okay, to track his different vitals, like the movements has been, which helps to, do a better analysis of the patient. And even to the rooms as well, some smart devices being deployed in the hospital rooms as well to track the temperature of the rooms and all those things. So we are seeing a great traction where hospitals are becoming a smarter hospitals and rooms are becoming a smarter rooms. So this is one area which is picking up very, very well. And second is like on the teleconsultation side. Okay, so a lot of consultation during COVID time, we would have seen like it has moved to telephonic consultations, video consultations. Okay, we are seeing a great traction from the companies which are building up these applications on the cloud. Okay, so they're building those, and even the very specialized offerings, very specialized diabetes related offerings, the whole entire workflow. So we are seeing like a lot of companies coming up, which is leading to a huge demand in terms of the technology database, the infrastructure, and the build-up of applications and all those things. So next is I'll talk about, in every aspect of applications or whatever the corporates are offering. Okay, there's a huge focus on how to make it easier for the person or for the patients. Okay, in terms of voice-based. So there's a lot of demand in terms of can people who are not very savvy to the IT side. Okay, can they talk to some smart devices and communicate what they want to do? And second is like some chatbots where people can chat with those chatbots. And then also the mobile apps, every hospital, I'm saying like every sub-industry vertical are putting their things on the mobile app. So we will see like, and more functionalities are getting shifted to mobile apps. So lastly, I will say here is like movement to the cloud. Okay, during the pandemic, people realized like, having the data loads on premise in the premises doesn't work out. Okay, to become resilient, we are seeing a lot of migration. The healthcare chains, the related arms are all shifting their in-house data loads to the cloud. And that's where we are.
Right. Resilience is the key word here that we are dealing with. So I'd like to probably, we and of course our listeners would like to probably know what Oracle's offerings, in the healthcare and pharma segment. So if you could probably throw some light, on what is there specifically for this segment.
So Garima, actually, Oracle has a whole business unit which caters to health sciences. Okay, we call it as HSGBU. Just plethora of offerings in terms of the clinical trials, product lifecycle management, in terms of product discovery and the patient management system. So a whole plethora of offerings which are required for running any healthcare institute. Okay, at the same time, so we have a very strong offering on the back office. We call it as back office, which covers the financial, the supply chain, okay, the budgeting, planning, employee experience side. And I think we are doing a fabulous job in this front. In terms of like, if we look at the top 3 healthcare chains in the country, okay, like Apollo Healthcare and the Fortis Healthcare, and then Esther DM. So in fact, like all these 3 largest healthcare chains in the country runs their back office and Oracle applications. Okay, and it's not only about the healthcare chain, we are bringing a lot of value to, I'll talk about, in fact, on health and safety, a very exciting thing, like, there was a time when COVID started, Oracle was very quick in turning around a health and safety application for our customers, which helped them to track the COVID instances. Okay, in terms of the whole COVID life cycle, in terms of like if someone has got infected, tracking the whole life cycle in terms of till the time the quarantine is there, how one recovers, and after that the vaccination cycle, the first vaccination dose, the second vaccination dose, and the booster doses, all those things. At the same time, when an employee is returning back, the whole life cycle, we were very fast in terms of launching out a product to take care of the global needs. And on the other side, like we have IAS and PAS as well, because every healthcare chain has some applications which are bespoke applications. So something like we have a very solid framework of infrastructure on a cloud where we can host their applications on our data centers, which can make their work much, much easier. And recently you would have heard of a very latest acquisition of Cerner, okay, which is a $28 billion acquisition, which is basically, Cerner has been a global leader in case management, in the patient case management system. So, with this acquisition, I think we are going to play a very, very important role in this space as well.
Right. Wonderful. We see a lot of, development happening there. So in terms of the business opportunities, we're already almost halfway through this year. So how do you see the landscape evolving throughout this year and of course in the upcoming year?
Okay, so yeah, it's going to be healthcare is an exciting space right now. Okay, in terms of like, I'd say like this vertical has been growing at 22% CAGR. Okay, compounded growth rate since 2016, a very rapid growth. Okay, and it's expected, like as per some government records, like healthcare sector may be roughly near about 2.5% of the GDP. Okay, by 2025. And knowing that the 70% of the population of India is based out of the semi-metro cities or tier 2 or tier 3 cities. Okay, so I think there's a humongous opportunity for everyone to help that, because when we're saying like so many populations lying in tier 2 and tier 3 cities where the healthcare infrastructure is not that strong. Actually, it is 30% of the overall country infrastructure is there. So I think a lot of hospital chains will come up. All of them will get linked. They will have a lot of technology demands. So this is something which is coming up very well. And another area is like, we are seeing wellness tourism is picking up very well in country. Okay, in terms of like a lot of countries, the people from different part of the globe, they're looking at India as a destination for getting their treatments done. Okay, so this is something which has picked up very, very well, and we are rated as number 3 across Asia Pacific and number 7 across the globe. So this is something which is picking up very well and offers a wonderful opportunity for everyone to provide a great experience to the global fraternity. Okay, now in terms of, I'll say like the last thing, I think one very important stat which I have is like in terms of the bed ratio, okay, per 1,000 people in the country. So we are still half of the global scale. Okay, we are still at half, which again, is a great opportunity for everyone. Okay, pandemic adding up to further opportunities. In fact, like it's posing a lot of challenge, but I think it's posing a great opportunity for every industry vertical to grow up, to scale up and become much more bigger.
Right. So, as they've been saying, there's been opportunity in this adversity that's, it's thrown up for a lot of people. Now, in terms of, there's a lot of ground to cover, as you mentioned, that, there's still a long way to go. So how do you think a collaborative environment can be built, for faster adoption of innovations in the healthcare systems?
So actually, Garima, while we are talking, this has already happened. I'll say like this has already happened to some extent. Okay, so I'll give you an example. Like there are so many technology aggregators. I will put it like if we look at like there are enterprises which has put in all diagnostic centers at the marketplace through an app. Okay, so a patient has an option to look at all the diagnostic centers in one particular mobile app and select the best one from the most, I would say, like where one is comfortable and get the best prices in terms of the, so in terms of much more, the best price what someone has to offer. And same way, like if you look at, so the medicines, there are applications which has put all the suppliers, okay, all the leading suppliers, and I'm saying like also all sort of suppliers on a single app where you get good discounts, good costing, and it's brought so much of delight to the patients in terms of sitting at their home. They can order the medicines and all those things sitting at home and get the best prices. There are second set of aggregators if you look at it, right? So like I'll tell you, like there are certain applications which provide diabetes treatment, right? Which is what they have done is they have basically stitched or consolidated everything, right from consultation to tests to measuring their insulin to tracking the different parameters of sugar and other things, and at the same time tracking on a day-to-day basis like what's happening in his life cycle. Okay, basically there are many similar companies. Like in case of diabetes, they're similar for heart. At the same time, there is something for cancer. The whole life cycle has been stitched together, or a collaborated approach has been taken for that as well. So basically, I'll say like, and the very basic building block is like, if you look at any hospital as well, so like I took many names of the healthcare chains, like there are 40 to 50 hospitals every chain has, and they're all stitched together in a single environment, okay, and the flow of information is seamless, cutting across everyone. So they're already like all the departments like pharmacy or diagnostics and consultations and everything working together. That's where we are. I think it's already happened, and I think much more to come, but still it's very well there.
Right. So we've seen a lot of discussions happening around, the Ayushman Bharat Digital Health Mission, and there is a lot of focus of the government also on this mission. So do you think, has it in any way actually catapulted the healthcare innovation segment per se?
So Garima, this is the world's largest healthcare program, okay, a vision of our Prime Minister, Mr. Narendra Modi. I think it's one of the best programs launched in 2021. And already it has some 50 crores beneficiaries, okay, and 10 crore families are already enrolled to this program. Okay, so and this has a network of some 24,000 hospitals where a patient can go and get themselves treated. Okay, and every family getting a cover of roughly about 5 lakhs per family. I think it's one of the best schemes which we would have ever seen in the entire many decades. Okay, so what it does is like it's providing a free care for the primary, I'll say primary care, secondary care, and tertiary care. So it's providing absolutely free of cost care to a person in our country. Okay, so I think this is a very strong vision, and at the same time with a very strong backing of technology and a very strong backing of people and technology coming together and do this great job. So I think this will create wonders for us.
Right, right. Thank you so much. So probably just one last question. We're talking about healthcare benefits for the masses. So in terms of your opinion, what are the measures that can be taken to leverage innovation for getting for making healthcare reach the masses?
So very good question, Garima. Actually, the key lies here is how the tech players like Oracle and others, make the technology so easy to consume. Okay, for an individual, in terms of when I said some voice bots, okay, where people can speak, or some chat bots where people can chat and things can be done rather than accessing application or being IT savvy. So I think it's a huge onus lies on players like us to make the technology so easy to consume so that everyone can use it, whether it's someone sitting in a village or someone in a very, I'm saying in a very remote location, so one shall be able to use it. And second thing, I will say it on a human side, we have 27% of the population is uneducated, okay, and 7% of the population lies below the poverty line. Okay, so again, onus is on all of us to educate them, to help them. Okay, so and help them to enroll for these great programs which the government has launched. And I'm sure our country will be much better country.
Perfect. Thank you so much, Mr. Singla. It was really enlightening to your thoughts and of course to the vision that Oracle has towards transforming the healthcare delivery in the country. Thank you so much for joining us today.
Thank you, Garima. Pleasure connecting with you. Thank you.